something to do with the centralized nature of how provider systems are set up compared to the more fragmentary system we see in the United States? I mean, these are amazing numbers and great penetration.
I think it's just led by the sheer social change. The social, the political, and the technology changes in Europe have come together at the same time. And also, I think that sense of society, rather than industry sorting this out, so it is patients like us, fellows getting together, there's that sense of a society driving the change. And of course, the internet just puts the society on the internet rather than in town halls or village halls. So it's society working together, probably as it's always done, but just on a much larger scale because of the technology change.
That's an interesting perspective. And so I want to go to the audience, having seen two very interesting rating tools at another site that allows for interaction between doctors and patients. We're really seeing the provider side come into play a lot more than the specific patient communities that ACOR and patients like me have. So if we go to my last polling question, will patients giving this type of feedback and providing these type of ratings truly result in provider change in behavior of providers? And will it truly improve services by institutions? Will consumer ratings of hospitals and doctors do anything? More yes or more no? So mainly we're optimistic that increased transparency and feedback will result in improved systems and improved services. That's optimistic. So I want to make one comment that brings us from the beginning to where we are now, and then I'm going to go down the panel for some closing observations as we head to the end of this wonderful discussion. So do you remember the 4 stages of Health 2.0, the slide we showed at the beginning of the day? We talked about user-generated healthcare. Then we went into a stage that was connecting consumers and providers. And then we had partnerships to reform delivery, and finally data drives discovery. What I found interesting just sitting and listening and re-engaging with my colleagues was that how just within the patient communities sector, if you will, that we're seeing all 4 stages. We're seeing user-generated healthcare, which is where we began, with blogs and stories and that type of user-generated self-publishing. We are seeing consumers and providers connecting on